Hi, my name is Jennifer Prime. I'm board certified in internal medicine and have been a hospitalist at Willis Knighton for the last 8 years. On March 14th of 2020, my life changed drastically. That was the first time I put on PPE and walked into the room of a suspected COVID positive patient.
Since then, I've spent almost every day doing that exact same thing. I now take care of the majority of the patients admitted with COVID-19 at Willis Knighton Piermont. Our daily census varies depending on the season and human behavior, but I normally have between 15 and 30 patients admitted at any given time. To date, I have cared for nearly 750 COVID patients and have lost 92 people to this disease. However, I'm not speaking today about numbers or data. I'm here to briefly talk about the human side of this pandemic, both the highs and the lows. As a hospitalist, I have never had a lot of continuity of care with my patients. I take care of them for a week, pass my list to someone else, and often pick up an entirely new list the next week that I work. COVID has been a much different experience for me. One of my great joys has been following these patients from the day that they come in to the day that they go home. I see them come in sick and scared, and I watch them get better. I see their families coming to pick them up. And I've been witness to reunions of husbands and wives, parents and children, brothers and sisters that have been amazing to see. In our patients, I've seen courage and grit and fierce determination. I've seen love and faith and amazing people whose acceptance of death and the peace that they find, who have restored my faith in humanity and bolstered my faith in God. I've witnessed breathtaking moments of beauty. I have a bond with the COVID nurses, the ER, and the other staff that show up every day to take care of these patients that I will likely never be able to put fully into words. Please know that we all owe these people a debt of gratitude. I've been reminded time and time again why I went into medicine in the first place. I am lucky and grateful to be a doctor on the COVID unit at this moment in time. While we do see much joy, we also see a lot of sadness. One thing you can never fully prepare yourself for in healthcare is the number of deaths that we have witnessed in the last 9 months. Many of these people we have taken care of for weeks. We know them and we know their families. We can see that they are getting sicker and sicker, and they know it as well. And for the first time, I have nothing to offer. They receive almost all of their treatment in the first 5 days. After that, it is out of our hands. Their bodies will heal or they won't. They beg us to please help as it becomes harder and harder to breathe. And the only thing that we have to offer is a hug, our time, words of encouragement, and if they choose, a ventilator. We have seen some miracles, but we know that once these patients go on ventilators, they do almost uniformly badly. Some of them still want to try, and when possible, we have them call their families first because we know it is likely the last time they will be able to do so. I have overheard conversations during these phone calls that will break your heart. My worst fear for my patients is that they die alone on a ventilator in the ICU, and to that end, we do everything that we can to keep that from happening. For the first time in my career, I have code status discussions with 45-year-olds the first day that they come into the hospital. They always cry because they are young and have never considered what they would want at the end of their life. I watch people struggle to breathe, isolated from their support system, with the news blaring out daily numbers of deaths from the disease that they are currently suffering with. When we switch to a comfort care approach, many family members are also sick or are scared of getting sick and choose not to come to the hospital. On the COVID unit and in the CCU, we take turns going into these patients' rooms and holding their hands so that they know they are not alone. I personally have been with several patients when they took their last breath. I call their families to give them the news. I know exactly what grief sounds like. People often ask me what it's like working on a COVID unit. The strangest part is spending 14 hours a day, 7 days a week in an environment where panic is always just below the surface. It's watching people adapt to handle more and more, working outside of their comfort zones, staying at a near frantic pace for entire shifts to be sure that all of the patients are taken care of. It's working in a state of barely controlled chaos and then driving home with the radio off and seeing people living normal lives, walking into restaurants, going into the grocery store, coming out of the gym. It feels like there is such a disconnect between the war we are fighting inside the hospital and the life everyone else is living. That is why those of us in the Willis Knighton healthcare system must support each other. No one else is going to do it. I am proud of the care that we have provided our patients. I am awed by the way the staff on the COVID unit have stepped up, worked themselves to near exhaustion, and then always show back up for more. There is no paycheck in the world that makes this job worth it. This is sheer dedication to the job that we do, to our patients, and to each other. We sincerely and humbly ask that you act as role models for the rest of the community, not only with your words, but with your behavior. Please wear your mask in public, social distance, and avoid large gatherings. Then encourage everyone that you know to do the same. Please help us and the members of your community by advocating for adherence to public health guidelines. We ask that you be loud, be visible, and to lead during this once-in-a-lifetime pandemic. I know that when I say that I've lost 92 patients, that these are just numbers to you. But to those of us on the COVID unit, these are individuals with names, faces, families, hopes, and fears.
I had a patient who every day, even up to the final days of his life when he was struggling to breathe on a BiPAP, would tell me the same thing when I left the room. He would say, "I love you and there ain't nothing you can do about it." We get attached to our patients, and these deaths are hard.
With adherence to public health guidelines, these deaths, as well as the extreme morbidity caused by COVID-19, can be prevented in future patients. Please do your part to stop the spread. Thank you for your time.